Hi everyone, and welcome to our Master of Public Health webinar today. I'm Hannah Davis. I'm the Recruitment and Conversion Manager for the School of Health and Life Sciences, and we are joined today by Martin Murchie, who is the Glasgow Programme Lead for Master of Public Health, and Baljit Chand, who is one of our International Recruitment Managers. So hopefully between us, we will be able to answer any questions you have about the programme. Martin's going to deliver a short presentation now, so please feel free to ask any questions you have throughout and we'll get to them at the end of the presentation. Just to say as well, you've been invited to this webinar today if you have applied or have an offer for either our Glasgow or London programme. A lot of the content is exactly the same, so it's relevant for both programmes. And just another quick mention that we will record this webinar so that we can send it out to anyone who wasn't able to make it, but we'll also send it out to all of our attendees today so that you have a reference point. Okay, so we'll just hand over to Martin now, and yeah, feel free to ask any questions throughout. Over to you, Martin.
Thank you, Hannah. Thank you. Welcome everybody, and thank you for your interest in the Master of Public Health programme here at Glasgow Caledonian University, and whether that be for Glasgow campus or for London campus, as Hannah said, this covers both because we have cross-teaching across both campuses, and the programme of study is exactly the same. Although you will have different lecturers and facilitators on each campus, obviously within the MPH team. So just like Hannah said, I'm the programme lead for Glasgow. If you have any questions around Glasgow campus particularly, then please, or if you're interested in studying at Glasgow, then please let me know. And you will also see on the screen the details of Razak, who is our programme lead for London. So if you're interested in London, then please contact Razak as well. Okay, so two key contacts for you. Although, as I said, the programme of study follows the same path with it. So I'm going to try and give you a bit of an overview of our programme and its development. So the MPH programme aims to prepare and develop you as a public health practitioner in order to do the key things around public health, which is really around prevention of infection and disease, the promotion of health, and also protect the well-being of the public. And that usually takes place through education, research, and public health practice and service. So our programme of study will cover all of these and aim for you to achieve that MPH and ensuring that through your period of study that you have covered all these elements of key public health practice. So like we said, the programme aim will develop you as a public health practitioner through the three key areas of prevention, promotion, and protection with that as well. And that will be done by us delivering education to you, which will include research and also key elements of public health practice. And that will cover three key domains as defined by the UK Faculty of Public Health from 2014. So that's around health protection, health improvement, and health services. So our programme will look at in terms of how we protect health, and we will know that's key and very important, having just gone through our years of COVID and still maybe dealing with that in some areas as well, in terms of how we protect the public from some communicable infections, but also about how we work with non-communicable infections, which really are conditions, which really covers things like how public health has changed quite dramatically, maybe from a major focus on infectious diseases to prevention and health improvement services around a lot of the communicable, non-communicable diseases that we have today and our conditions. And things like that, we're talking about maybe diabetes, hypertension, smoking. There's many things around the health improvement and protection part that we'll look at with that, as well as the health protection. We're also looking at, and we'll discuss in terms of how to carry out health service development, and that includes things like health needs assessment, social action and need for change, and that engagement with the communities or the target groups that you're looking at, and also making sure that health and the services provided are equitable and accessible with that under the public health umbrella. This is just some of the feedback that we've had from our students who have been part of the course. So as you can see, that there's major things to be gained from it, and also in terms of people's experience has been really positive of the programme itself. So that's in terms, that ranges from support from the lecturers, whether you're in Glasgow campus or London campus, then you will, the support has been rated and fed back as excellent for both of these campuses around this. And also in terms of how it's increased people's capabilities and knowledge and understanding to develop them going forward as a public health practitioner as well. So some really good feedback we've had, and we really appreciate any feedback actually through the programme that helps us develop, edit and support students appropriately. This is to give you a bit of a flavour of the programme flow for the programme if you're starting in January this year. So that would be trimester B, as you can see here. And within that trimester, when you start within January or the end of January for trimester B, you'll be studying 4 modules within that trimester. So the core modules are social action, approaches in public health. I'll talk a wee bit more about them in a minute. Applied statistics in public health, evidence-based public health, and then you have an optional module between 3 options, and that's infection prevention, health economics, and I think the last one might, in my screen, looks as though it's just a bit hidden, but oh no, I think it's okay, is navigating the policy of public health as well. Moving forward into Tri A, which would start in September 24-25, you would then move on to participating in advanced research methods, the principles and theories of public health, and epidemiology of practice. And that would be your Tri A modules, moving into your dissertation if you're successful for Tri B of that following year. Okay. You can see from this just now that each module has a level of credit attached to it, which is how you achieve your overall Master of Public Health. However, we will show you in terms of other forms of achievement you can have, depending on the amount of credit that you achieve through it. So you can see that most things are 15 credit modules, apart from Advanced Research Methods, which has a 30 credit attached, and the dissertation is usually 60 credits. So just to dig in a bit deeper in terms of the provision of these modules and what is expected from you, each module will run for roughly 12 weeks of the trimester, around that. And each of those modules, there will be a variety of delivery. So that may flip between some online classes and then building on from that some tutorial classes. So we may do an online lecture which will cover both campuses 1 week, and then to build and dig deeper into that and to deepen and give breadth to your knowledge and understanding, we would then take some of the key points from that online lecture and take it into tutorial and seminar classes. We will explore that face-to-face with you with a facilitator. That facilitator in the module will be with you through the life of the module. So we'll be with you through the 12 weeks. So they will be the person who you would engage with in the module itself. Each module may have different facilitators for the classes, but if I was your facilitator for principles, then I'll be with you for the full 12 weeks of that module as your facilitator around it. However, you will also experience within the modules the range of staff experience. So we have a variety of lecturers within the MPH programme with a variety of experience. So some of that comes from practice, some of that comes from policy development, and some from research and evidence as well. So we have a whole plethora of experience within the module and the module's delivery to you. So you get to experience everyone, because what we tend to do is people will also be delivering online sessions. So even though you have me face to face, you'll have some of the other lecturers and using their experience on an online lecture at that point within the module. So you can see here in terms of the assessment criteria, most of our assessments are around coursework assignments. So the written words of maybe about 3,000 words are the key ones for some of our 15 credit modules. So each module will set an assessment question for you, which will cover the key learning outcomes from each module. So at the very beginning of the modules, we will explain what the key learning outcomes are and how we're going to help support you achieve them through the life of the module, on to supporting you through to your summative assessment at that point as well. Advanced research methods is the development, is the only one that's slightly, well, there's a couple that's slightly different, but if we look at advanced research methods, that will be where you might start to design a research protocol for planning for your dissertation. So that can be a structured literature review, an SLR as we call it, whether that be qualitative or quantitative. So it could be a proposal around that, or it can be a piece of original research that you want to conduct for your dissertation as well. Obviously, we have to look at the achievability of both of those things within the time periods that we have, particularly if you're doing a brand new piece of research which will need ethics approval, etc. as well through it. So we would work with that. But that's what ARM is tending to do, is help you develop your research protocol, starting you to get to think about your dissertation, and then moving that forward when you come to your dissertation at that point around it. If we look at some of the other examples which aren't the 3,000 words, we have evidence-based public health, which is a poster presentation that you must deliver for that based on the module learning outcomes. It's equivalent to a 3,000 word assignment, but it's within the template of a poster presentation. And then you have navigating the policy context, one of the optional modules that has a presentation element to it, and a 1,500 word written part to it as well. So there's a few different things there, even a examination of an open book exam for health economics. So you can see in the blue are all your core modules that you must take to be part of the MPH programme and leave with an MPH if you achieve all the credits. And then the orange on here are the 3 optional modules which you get to choose one of within trimester B. So as if you were all starting in January, you would be able to choose from one of these 3 modules to participate in from January for the 12 weeks of trimester B. So just talking a wee bit more about the optional modules, you're asked to rank them in 3 choices. So it's like your first, second and third choice, because also there's only so many spaces in each module on both campuses as well. So we have to try and do that fairly and distribute that fairly as well. So you have then looking and exploring the policy of public health, how you develop that policy, and then how you navigate that and put that into practice for you. And then we have infection prevention control in a global context. So that's looking at the infection and prevention of diseases and conditions, but not just within the UK, in a more global context. And that's one of the things maybe I would say is really useful within the MPH programme, and that we're very lucky to have, is a large experience of from international students, where you would be bringing a lot of your experience and sharing that not just with your peers, but also with us within the module, the lecturers. So there's real student engagement where you participate, and also we learn from each other within the module, not just in the global context infection prevention, but actually through all the modules as well. And then we have the last choice of the 3 is health economics, which helps you understand in terms of the cost of providing health, and in terms of how we come to decide what is provided by who and the costs and implications of that as well. Health economics are really key in public health in terms of how we look going forward, planning interventions or services or prevention as well. So looking at the outcome awards, obviously we are the Master of Public Health programme. And for that, that would be your overall achievement that you're looking for. However, you can leave with different awards if you wished, or if you failed a module after 2 attempts. At each level 11 module, which you're studying at master's level, you have 2 attempts at the assessment. After that, you have no further attempts, although there are some appeal processes you can go through, but usually you would only have 2 attempts. So you may hopefully finish with an MPH, and we will do all our best to support you to get to that. But however, whether you fail the module or you decided to leave earlier, there are some other options for you. So you can leave with a postgraduate certificate in public health, a postgraduate certificate which would include social action as well, or you can have your postgraduate diploma in public health as well. So that's just in terms of trying to detail here what you would need to achieve to leave with those other versions of outcome awards rather than your Master of Public Health. So as I said, we have quite a team. We have myself, and my name's cut off there a bit, for Glasgow. We have Razak for London. We also have a program coordinator, Nikki McGuire, who is key in ensuring that everyone is attached to the correct module and keeping the module and the program running and forward, and ensuring awards are there and marks. And we have a program deputy leader in Glasgow, Shadrach Deer, as well, who assists me with the program here in the Glasgow campus. But beyond that, we have another probably 12 staff between Glasgow and London who work predominantly within the MPH team, all with a variety of MPH experience, as I mentioned. I wanted to talk not just about the programme, because your programme of study is obviously very key, but also we have to talk about the wraparound services that support you during your time as a student at Glasgow Caledonian University. And that helps you kind of adapt to university life and what is expected of you in terms of your academic writing and I suppose development within the programme and the university itself. So we have a learning development centre and an academic development tutor. So we have these services on Glasgow and London, and the learning development centres can assist you with developing your writing at level 11. Some of you may already be writing at that level, or it might be quite new to you in this form of assessment. But either way, we can ensure that the Learning Development Centre are within all our modules, delivering sessions, but also you can access them on a one-to-one, and they have a major website that has a variety of support information there around writing and how to achieve your goals at level 11 as well. So that's one of the major services we have. We have the library, and we have specific library staff who will help you understand in terms of how to do your literature searches, how to ensure that literature you're searching is valid and current, and the research that you need in terms of to support your writing and your development and your knowledge when you are studying within the MPH programme. So the teaching is very important, but also there's a lot of self development for you within the university. And that includes in terms of stuff that you can take forward into your career as a public health practitioner, particularly when you're providing evidence-based care or guidance or protocols. We have a student wellbeing service also around, and they can provide a variety of support, one-to-one counselling, advice for you as a student while you have your time here within the programme as well. We also have visa. If you have visa requirements, they are key to link with and to discuss your visa requirements and to ensure that we meet your visa requirements when you're here as a student. We have careers advice also, and we have the Students' Association around for you, an internet cafe, and also you will be assigned a personal tutor for your time within the programme. So that's a person who's assigned to you, maybe myself or someone else from the programme team, who you can link with for a variety of support. So just someone to check in with, to talk about your academic development, maybe about your career development, in terms of also just ensuring that you, if you're needing something particularly, then that we link you with the correct service for that as well. So you would have that person through the whole period of your programme of study. And it's usually allocated to you within the first 3 to 4 weeks of joining the programme. So I think I've kind of covered most things thinking about the MPH. I'm just trying to think if there's anything I've missed for you. So both campuses will have a variety of these services for you. And when you join the London or the Glasgow campus, we will help you understand who are the facilitators and lecturers that you have within the campus itself. Although, like I said, you will get to know all of the facilitators and lecturers through both campuses, because some of the London staff will also deliver some of the online sessions that are required, because we want to use people's experience appropriately so that you get the best experience from the programme and the staff involved in that as well. So I feel as though I've rattled through that. I feel it's been a whirlwind moment of the MPH programme. But we're a very successful programme with a variety of students, and we're always delighted to have our students join and bring their experience with them. So I don't know if there's any questions that maybe have come in the chat, or any questions now anyone wants to ask.
Thanks so much for that, Martin. That was very informative. I think everyone will agree. If you look at just a bit further up the public chat, there's a couple of questions from Clinton.
Okay. Clinton, let's have a look.
Yeah, it's not that far up, but you should be able to see them. There's two there.
Lovely. It's nice to see the variety of countries and places that people are as well, that people have popped in. So we've got Ghana, Nigeria, it's fantastic, and Pakistan. So lots of really good experience we could have. That's fantastic if you come and join us. Right, Clinton, here we are. So Clinton, in terms of looking at employability, I mean, in terms of GCU, and Hannah might keep me right in some of this, GCU has some of the best employability outcomes for a university within the UK. I can't remember the exact percentage, but we're one of the highest for employability post a programme of study. So I don't really know where that information came from, Clinton, to be honest for you, but there's a variety of jobs you can do in public health, and it may depend on what you're looking at doing. So, like I said, public health practitioners work in a variety of settings, and some of that can be research itself, in terms of looking at research and evidence base, or it can be within policy development, and that can be in government bodies or within NHS or local council departments as well. It covers a variety of things in that. We also have practitioners on the ground who may be working sometimes within a clinical setting, or maybe working in health improvement and health promotion on a variety of different things. So if I'm thinking of Glasgow itself as a health board, as an NHS health service, there are health improvement services that employ MPH graduates that cover things like smoking cessation, like I said, diabetes, healthy eating, sexual health, HIV prevention. There's a whole plethora of roles and places for people with an MPH, and that's not just in Scotland, that's throughout the UK, and also through, I suppose, through the world as well. And also, we don't have to just be what we call statutory employment. Lots of charity organisations will also employ people with MPH backgrounds in terms of to help support their charity work, depending on what their target is. So that I'm thinking of like the British Heart Foundation or the Terence Higgins Trust here that looks at sexual health for the UK as well.
Just to add to that as well, Martin, I think the stat that you were looking for, so it's 91% of our students go on to further study or on to employment within 15 months of graduating.
Thank you very much.
Yeah.
That was the one. I knew it was high, but I just couldn't remember the figure. So that's fantastic. So thank you. So there we are. So that's how high the employability rating is for the university. Let's have a look at the next one, Clinton. So Clinton, I don't think, and I don't know again whether someone else knows this answer, but in terms of the visa requirements for that, I don't think our MPH course does meet that amount of research activity. So I don't think we do meet the requirement, but I could be wrong. But that's where we'd need some advice from Visa, Clinton, on that, I'm afraid.
Clinton, I'll just put the Visa contact in the chat just now. You can maybe get in touch with them directly about it. I just wasn't sure, Martin, in terms of the relation to research activities, whether or not you would have any knowledge on that. But
I don't think we meet it, Hannah, if I'm being honest.
Right.
Yeah.
Okay. Well, I'll put the Visa contact in anyway, Clinton, and you can pick it up with them, okay?
Lovely. Thank you, Hannah. Yeah, Clinton, I'm really sorry. We have no control over the immigration visa requirements at all. We have to abide by them. So unfortunately, I don't think we meet it, but Visa will confirm that for you.
Just also to say, obviously, while you were talking, Martin, there's been lots and lots of questions just about application status for a lot of students that have joined the webinar. Just to say that if there's any specific inquiries, I think, Baljit, did you pin a message to the top to say, send your student ID to international@gcu.ac.uk, is that right?
That's right, yeah. So if students can send their student ID numbers and the course details to us, then we can look it up. I wouldn't encourage to share your student ID unless you do it in a private chat. But please don't share your student ID in the public forum. Thank you.
Yeah, and we can pick them up individually if you send them into the international@gcu.ac.uk inbox. And hopefully get them kind of actioned for you as soon as possible. We're still very much processing applications for January 2024. We've had an extremely busy intake so far. So bear with us. We will do our best to get your offers out and to get processing your applications, okay? Martin, there's just another question that came in. You might be able to see it. It's from Annabelle.
Yeah. I see that there. Annabelle, in terms of looking at the MPH programme, the minimum academic requirement is looking at the equivalent to a UK honours degree at a 2-2. Now, I'm unsure of whether what you're telling me you've achieved would meet that. However, there are also other things we look at as well as your academic achievements. So some of that is sometimes, even if you don't meet maybe the minimum criteria, your application would be sent to myself to review as the programme lead. And from that, I would look at in terms of your statement of support, maybe your CV for experience in public health. So a variety of different areas, certainly in terms of looking at laboratory and technology and microbiology, it certainly is certainly something that I most likely think would have modules, and your transcript would demonstrate relevant modules for public health. But whether that HND was equivalent to what we're looking for would need to be decided with the admissions process, and if not, they would send it to me for a discussion or a consideration if they thought everything else looks like you've got a lot of other stuff going on that would support your application as well. So certainly, if in doubt, Annabelle, I would suggest you apply, and then we can take it from there and have a look. And I don't know, again, whether, Hannah, you would have any more insight into that in terms of the admission and the requirements, or how that would transfer across. It's probably needs looked into a bit more, I think.
Yeah, absolutely. I would probably agree, Annabelle, that it's worth just getting your application in, and then we can take it from there in terms of whether that needs kind of a further review, or whether it's kind of easily transferable. But if you can get your application into us, we can certainly have a look at it for you. Hope that answers your question. There's another one just there, Martin, from Comfort. who would
So
love
the
to know more about
the open book. So Comfort, there's a variety of different exams that we have. So sometimes we have closed book exams, which where you don't know what the questions are until you're within the exam. An open book exam is more that we might, or an open book or a take-home exam is something where we might let you know what the question might be, so you can start to think and look at that question and develop some of that prior to the exam itself. And they're used in a variety of different programs and modules around that. Or an open book might be that we give you, you're allowed to use a particular book within the exam itself. So although you may not know the questions, what we would say is you can use this book, but only this book within that examination process as well. They're rigorously done, whether they're face-to-face or whether they're online. We still have to follow the assessment guidance to ensure that quality is there and that there's no coursework irregularities. But that's basically what it means. It means an open book would usually have a book to work from that you can use during the exam, or a take-home exam might be something that we let you know the question and you then answer that question from it before the class or before the exam takes place. You have time to develop some of that. Let's come down again. So Adiola, I'm sure I haven't missed anything else about Adiola. Looks like next from Comfort. Yeah, exactly. Your research and dissertation could be in children's public health, Adiola. Yep, absolutely key. It can be around children and public health. Yep, that would be completely appropriate. What we try to do at Adiola is let you know, with your dissertation, when you get to that point, you're allocated a dissertation supervisor who will work with you on a one-to-one basis to keep you on track for your dissertation submission, because it's a large piece of work and takes a lot of work from you to achieve. So we want to make sure you've got support through it. So it's a one-to-one. And what we tend to do is sometimes let you know sometimes about the supervisor's interest. So there might be somebody from the child field or with a public health background in children who's more who would be more appropriate for you. Either way, any MPH lecturer or any supervisor would be appropriate, to be honest, but we do let you have a look and see if there's someone who might fit your criteria a bit better in that. So Timmy, Toby, I can see that you're asking how many days per week is the MPH programme in London. So it's obviously a full-time programme of study, which is really what you should commit to. However, you're absolutely right. You wouldn't be in university every single day. So if we take trimester B, when you would start, if you were coming along in January, your classes would run, those modules would run probably Monday to Thursday. So you might have one on a Monday morning, one on a Tuesday afternoon, one on a Wednesday morning, one on a Thursday afternoon. But that would be a variety of possibly some of the sessions being online and some of them being face-to-face tutorial classes. And that's the same whether that's Glasgow or London. That would be the kind of, I suppose, the template for the week for the programme. So it would be Monday to Thursday because you've got 4 modules in it. Going into trimester A, there's 3 modules, so usually that's like Monday to Wednesday. And the reason why there's a bit of a mix in it, because if you're on campus, it lets you then visit the library, lets you meet with your peers, and lets you do a bit more of a mixing and developing your academic career, and also with engagement with your student peers as well around it. And then you have some time, obviously, for further study, because there may be further reading from the sessions that you have to take on, or there might be prior reading for some of the tutorials that we'd ask you to do for coming along to tutorials as well. Where are we? Was I wrong, Hannah? I thought somebody had their hand up, but it looks like it's gone again, I think.
I think someone possibly did have their hand up. Was it Comfort? Because I think student support have said, could you please post your question in the chat box so that we can pick it up for you? So I don't know if they put their mic on, they might be able to ask you directly, Martin, but we'll see whether or not they post their question in. There's Lucy just underneath who's asking about her BSc.
Yeah, nutrition. Yeah, so definitely, Lucy, again, looking at your dissertation and maybe your ARM protocol, nutrition and dietetics are really key in public health, in terms, particularly when we're looking at sometimes the non-communicable disease prevention of it. So certainly that would be a reasonable topic to have something around that in the public health context. Part of that is looking at, when you're thinking about your dissertation, is looking at something that will have an impact and a difference for public health practice itself, and may have some recommendations for further research into it as well. So these are the key things. So as long as it fits around under the public health umbrella and has an implication for practice, then that's exactly what we're looking for.
It looks like we are potentially up to speed, Martin.
Lovely.
I've just posted in the chat, if anyone has any further questions that they would like to ask Martin, this is the best opportunity you're going to get to speak to one of the programme team. So please post any of your questions in the chat. We'll stay for another couple of minutes.
Yeah.
Oh, there's another one.
Just before I answer Chinonzo's, Moses is asking, Hannah, Moses, you've sent me a direct message just asking about how you get your student ID after he's sent his application. So Hannah, I don't know what you would do around that, if you can advise him. Yeah,
of course. Moses has actually sent me a direct message. Moses, I'm coming back to you. I'm just jumping between a few different chats at the moment. So Moses, I'll come back to you, okay? And we'll pick that up offline. Sorry, Mark.
Thank you, Hannah. No worries. That's great. So Chinonzo, what we're doing. I'd like to know if classes run from Monday through to Friday, or are there specific days for classes. So yeah, Chinonzo, that's what I was trying to explain. For Tri B, the classes would be Monday to Thursday, most likely. Now, things can change depending on our programme and our room allocations, but roughly, usually Tri B runs Monday to Thursday, and Trimester A runs Monday to Wednesday for your campus time. You can also come to campus other days as well and use the library, support staff, etc. But those were the days you'd be expected to be attending the classes. And as like I said, it may not be the full day, it may be part of the day, depending on when the class is scheduled. Let's have a look. There's another one there. Ooh.
Just having a look as well, Martin.
It just keeps changing really quickly, so I keep losing where
I know.
I'm looking actually there.
Well, there's just a few people that have joined.
All right. Okay.
Hi, Mary. Have we got any other questions that we would like to ask? We'll stay on for a couple of minutes, Martin, just in case.
Yeah, no worries. We can stay here. Just let me know if there's anything else you think hasn't been covered. I'll maybe take this back to the slide of the trimesters, so you can have a look at that.
Oh, there's a question from Peter. Baljit, I think you've got the answer to this one.
Yep, so what was the question?
It's about employability again.
Just curious about the employability rate for MPH graduates. So no, I don't have the rate specifically for MPH graduates in the UK, but generally speaking, our institution, the rate is 91%. We do have a career service on campus, actually in Glasgow and London as well. So our career service can actually support you for up to 2 years after you graduate. So if you are having any trouble securing a position, securing a graduate job, our career service are there as well as a resource to help you find a position.
I should have said as well, actually, Ashabel, that we do bring in people from public health as well to get a greater understanding of public health roles, and also we have some sessions on careers as well within the programme.
Okay, hopefully that answers your question, Peter.
There's a question there about the offer letter.
We're jumping a bit again. Moses, right, okay, So see any of these questions that are specifically related to admissions or your admissions process, or your conditions or anything like that, we're actually going to just move them to a separate chat to get answered individually. But just to state again, you'll see that message that is pinned to the top of the chat. For any students that have submitted applications and may not have heard back yet, please email your student ID and course details to international@gcu.ac.uk, and we can pick this up with you individually if we don't manage to get to it during the course of this webinar. Please note that the application deadline is the 27th of October, and we're still very much processing applications for January 2024. It's just been an incredibly busy intake for us. So please bear with us and we will get back to you, okay?
Lovely, thank you, Hannah. I think that would cover Chinonzo's as well, but about scholarships and eligibility, I think.
Yeah, Chinonzo, we'll also put a post in the chat with a link to the scholarship pages on the website, and it will provide you with all of the information we've got on any possible funding, okay? And hopefully that will answer your question.
So, Mary, you're asking about with a MPH get professional job to practice as a public health officer. I'm not sure where that terminology comes from in terms of what a public health officer might be. However, there could be public health roles, like I said, in a variety of public health fields. Sometimes health promotion, health improvement, research, or maybe within practice as well, looking at stuff. You may not, it depends what that role is. So if you were wanting to be, I'm trying to think of like a medic, a doctor or a nurse within public health, then you would need those professional qualifications. But there's huge amounts of other roles that aren't nurses and medics within the public health field that you would be certainly employable for. And usually within post, they might then put you through further training, depending what else you might need to help support you as a new person who's been employed by them. And Gracie's about scholarship again, I think, there.
Just very quickly on the scholarships. So we do have a standard scholarships that all of our international students are eligible for. So that's a new to GCU scholarship. So for the January intake, that is going to be £2,000. So yeah, that's a standard scholarship that we have. And then as Hannah mentioned as well, if you visit our scholarships page, then there could be other scholarships that you're eligible for. But that's the best place to do your research.
Thank you.
Just to say, I've just popped the scholarships link in the chat just now. So for anyone who's been asking about it, please feel free to visit that, and that will provide you with all of the details on our funding and scholarship opportunities. Okay, have we got any final questions for Martin that are programme specific, so related to the MPH programme? It sounds like it's been, sounds like everyone is very much engaged though, Martin.
Yeah,
sounds
it's
like
great.
Everyone's excited about joining the programme in January, which is great to see.
Yeah, be excited to have you all if you come along.
Mohammed, your question about updating the email address, you'll need to contact our IT department. Again, details are on the website, but I can also pop in here for you just a second.
While you're doing that, just to say, Mary, yes, with an MPH you can get a job with NHS in the UK. Public health is also provided by a variety of other people, like I was saying, Mary, and sometimes a lot of local governments or councils employ people with an MPH background as well to take forward some public health particular programmes within them.
Okay, any last questions? I feel like you always say that and then
The one pops up.
one pops up. Okay, I think that might be us.
Lovely.
This has been a really, really informative, well-engaged webinar, Martin. So thank you very much for your presentation. And thank you to everyone that attended today. It's been great to have you. We are obviously very excited about the prospect of you joining us in January. Can see that there's lots of inquiries related to admissions, so we will do what we can to pick them up following this webinar. We obviously have notes of names and people who have joined us, but also just remember that message that's pinned to the top of this webinar and take a note of that international@gcu.ac.uk email address, because if you send your student ID and your query to that email address, Baljit, who's on this webinar, will also be able to pick any of those inquiries up. But yeah, we're all very excited about the prospect of you joining us. Thank you so much for being on this webinar today, Chinozo. I can see your question about the payment plan, so I'll just transfer that to the Q&A just now and send you the link to the payment plan, okay? Because we've got information on that on the website. So we'll be able to answer that question for you. But just as a final sign off, thank you so much from Baljit, Martin and I. Oh, Mary, are you asking about swapping? Yes, you can swap your campus if you email admissions@gcu.ac.uk directly with your student ID, just stating that you wish to swap campus. They should be able to sort that out for you. But yes, last sign off. Thank you so much, Martin. Thank you so much, Baljit, and thank you to
You're
everyone
welcome.
today. And we hope to see you in January.
Lovely. Thank you all for coming. Hope to see you soon.
Thank you.
Thanks, everyone.
Bye. Bye.
Bye-bye.